Please welcome my next guest, Antionette Izzo, with Novant Pulmonary Medicine in Shallotte. How are you today, Antionette?
I'm doing well. Thank you for asking.
I'm so happy you're here because I have a personal connection with sleep apnea. Having it in my household, it can be very annoying. So before we get into that, tell me a little bit about your background, your education, and what brought you to be a physician assistant and specialize in sleep medicine?
All right. I started in undergrad at North Carolina State University, and a few years later decided to go to PA school and was able to attend East Carolina University. And very recently in May, I actually graduated with my Doctor of Medical Science from the University of Lynchburg, so that's very exciting.
Oh, that is exciting. Congratulations.
Thank you. And I started my work as a PA in Columbus County in the emergency department, and I had a small child at the time.
Yeah.
I felt like I needed some different hours, and so I was able to join the practice in Wilmington in 2006, and I have been working in pulmonary and sleep since then. Initially it was pulmonary and sleep. Now, probably since 2008, it's been mostly sleep.
Sleep. Yeah, I know that you were several years in Wilmington, and then you recently started seeing patients in Shallotte, and that's such a beautiful office.
It really is.
Yeah, it is great, and that's part of our new Novant Pulmonary Medicine in Shallotte. So let's talk about some of the conditions a patient might be seeing pulmonary for. What might that be?
The most common pulmonary conditions would be COPD, asthma. We do see people for lung cancer, for infections in the lungs. So those are the pulmonary conditions. And of course, the pulmonologists and me and the other PAs and NPs see patients for sleep. And so the sleep conditions, mostly sleep apnea, but then of course insomnia. That's a common one as well.
Oh, really? Will you do pulmonary function tests at the Shallotte location?
We do. So we have a fully functioning pulmonary test there now. And of course we can get x-rays and CAT scans if needed to review before the patients come in. So all of that is done locally.
Do you do the pulmonary function tests or?
No, one of the nurses does it.
I see. So they have, that's nice that they have the unit there.
Absolutely.
Yeah. Well, today I wanted to focus on sleep medicine because that is your specialty. And I can't tell you how many people I've talked to who go, oh yeah, I wear a CPAP. There are so many people I know.
Yes.
What are some of the signs that you might have to indicate that you have an issue?
So I would say the most common things are people will say despite sleeping a normal amount of time, they are waking up not feeling refreshed, and they might get more tired than they think they should during the day. But truly the most common thing is someone's being told, you need to get help because you are making a lot of noise, and the bed partner leaves the bedroom because they can't stand the noise. So that's the number one reason people come in. Yes.
So either their wife or their husband or their partner says, you're either snoring or something's going on, and I can't sleep with you anymore.
Absolutely. That's what motivates people.
That's what my audiologist says. Usually it's the partner who says, you can't hear, you need to go get your ears checked. So similar thing. So are there different types of sleep disorders? There
are. So there's even different types of sleep apnea. And so there's different sleep apnea types, different...
Really? I didn't know that.
There are. So the most common one that you hear about when we're educating the public and doing health fairs, things like that, is obstructive sleep apnea.
Okay.
But there's a type that's called central sleep apnea, and that has to do with the central nervous system.
Okay.
It's a signaling problem. And there's complex sleep apnea, which is both kinds of sleep apnea kind of combined. It is. And then, of course, with insomnia, there's not really different types of insomnia, although insomnia can be temporary or chronic condition, and so
yeah,
we do
yeah.
treat it differently depending on what it is.
No. So how do you actually diagnose somebody with a sleep disorder? And does everybody need a sleep study?
You would think everybody needs a sleep study, but they don't.
Oh, I didn't know that either.
So there are people who come in for a consult, and after I speak with them, I'm able to determine that they really don't need a sleep study. So it's rare because we have such great people who are referring patients in,
Right.
that they really refer the folks who need the studies. So that's the issue. So they're just good at referring. And so when people come in to see me, one of the big decisions I have to help them make is what study is going to be appropriate. So you may or may not know, but we do studies in our facility here at the Brunswick Medical Center.
Right.
And we also do them at home, and
Yeah.
that's part of why I need to do a consult with patients to try to figure out, which study is appropriate.
Wow, that's a lot of information. Let's talk about devices, CPAPs or whatever. How do you treat this? What's that?
You're right, the most common treatment is CPAP, and so that is the little mask.
I only know
people
that
wear.
because my husband wears one.
Yes. So that's a mask that people wear that's attached to a little air pump, and the air pump blows air into the throat to help it stay open so that people breathe normal. So the second most common treatment we use is a mouthpiece. It is custom fabricated by dentists who are trained in sleep medicine. And it just moves the bottom jaw, a little bit forward to open the airway. And then we have a newer treatment that we've been using, 2 or 3 years now. It's an implanted device, and it actually stimulates the tongue to move forward.
Oh, really?
Yes. And it's reserved for the moderate or severe sleep apnea patients who cannot tolerate CPAP.
Wow. I can't wait till you come back because I have some more questions, but we're out of time. So, again, you're in Shallotte.
Yes.
And we can run your phone number on the bottom. You're taking new patients, right?
Yes, we are.
Okay, that's great. Well, will you come back and talk to me more about sleep?
I'd love to.
It's a great topic, and there's so much to learn.
Yes, I'd love to.
All right, thanks again for being here today. We really appreciate it.
Thank you for having me.
You're quite welcome.
All right.